Good day everyone, this is Shahidul Haque. As a part of the module Digital Transformation and IT Governance in Modern Enterprise, I am going to present on my individual project. Imagine a situation, a junior doctor is on night shift, it is 3 a.m. He has already seen 40 patients. He is tired, hungry and running on coffee. Now a patient comes with vague symptoms, chest discomfort, dizziness, shortness of breath. Is it stress or is it indigestion or it is a early symptom of heart attack? This is not a technology problem. This is a human decision making problem under pressure. Today, healthcare organizations are asking, can AI help clinicians make better decisions without replacing them? And more importantly, how do we govern AI so it helps instead of harms? That is what my presentation is about. Healthcare is one of the highest risk decision making environment in the world. Decisions are complex, time critical, and sometimes irreversible. This presentation explores AI enabled clinical decision support system. In short, AI CDSS. It's not a shiny technology. It's a governed socio-technical system. Before jumping into AI, we must understand the environment where it operates. Our industry is healthcare, especially a medium to large tertiary hospital. Think the scenario where emergency unit, ICUs, radiology, outpatient departments deal with high patient volume, high diagnostic complexity, and zero tolerance of mistake. Doctor faces decision fatigue, diagnostic variability, regulatory and patient safety pressure. So the question becomes, how do clinicians make consistently safe decision for under pressure for patient? Before we talk about AI, it's important to understand digital transformation happening in healthcare and contributing in value chain. Hospitals have rapidly adopted technologies like electronic health record, AI, and data analytics to improve outcome and efficiency. This means clinicians now have access to more information, more data ever before. But more data doesn't make decisions easier. It is actually increasing decision complexity. Doctors are expected to be faster, more accurate, and fully compliant at the same time. As a result, healthcare organizations face growing pressure to improve quality, speed, and accuracy simultaneously. This digital context set the stage for why AI-supported decision making has become necessary to facilitate the healthcare value chain, and this leads directly to the decision making challenges clinicians now face. The problem definition: clinical decision making challenges. Clinical decision making is becoming increasingly complex. Doctors today must process massive patients' data, rapidly changing clinical guidelines, time pressure, and legal and ethical accountability. Let's be honest, humans are brilliant, but humans are not database. Research shows that decisions fatigue, information overload, fragmented data system is increasing the risks of diagnostic error, delayed treatment, and patient safety incidents. And in the healthcare, even a small mistake can have serious consequences. No, not just medically, but legally and reputationally. Why this problem is strategically significant? When clinical decisions go wrong, the consequences are serious. For patients, harm or death. For hospital, lawsuits and regulatory penalties. For organization, loss of trust, and trust is the capital of healthcare. So this problem is not only clinical, it is organizational, ethical, and societal. Now the question is, how do we support clinicians without replacing them? So our proposed digital solution is AI enabled CDSS. So what exactly is AI enabled clinical decision support system? AI CDSS analyzes patients' data, identifies risk and patterns, provides evidence-based recommendation. And let me emphasize something very clearly. AI CDSS doesn't make decisions. It advises. Think of it as the Google map. Google map suggests routes, but you decide whether to follow it or ignore it. In healthcare, the final decision must always remain human. Human in the loop decision boundary. This is where governance becomes critical. In my proposed model, AI analyzes patterns and risk. Human interpret, decide, and remain accountable. The AI says, based on similar case, this patient has a high risk of sepsis. The doctor says, yes, I agree, or I don't agree. And here is why. This human in the loop approach protects patient safety, professional judgment, and legal accountability. If AI crosses the boundary, we lose ethics, legality, and trust. Now, let's justify why AI CDSS is the right technology choice. In my technology justification, this table shows why AI-enabled CDSS is the best fit. Manual decision making depends entirely on clinicians, which works, but it also means doctors are expected to remember everything. Even at 3 a.m. in the ICU, that leads to fatigue and inconsistent decisions. Rule-based system is improve the consistency, but they are a bit like a rigid checklist. Good for routine case, but struggle when patient don't read the textbook. AI CDSS, on the other hand, can analyze large amount of data, adapt to complex situation, and highlight risks, while still leaving the final decision to the clinician. So AI CDSS doesn't replace doctors. It simply makes sure they don't have to work like machine. Compared to manual decision making, AI reduces cognitive overload. Compared to rule-based system, AI adapts to complexity, supports consistently across clinician. Rule-based system are like checklist. AI adapts to complexity, evolving data. Rule doesn't learn, AI does. AI is like a junior specialist who never sleeps. Unlike human, it doesn't need coffee. Strategically, AI CDSS align with hospital goal, better quality of care, efficiency, and patient safety. In short, right technology, right context, and right governance. Implementation strategy and timeline. Implementation is not installing a software and pray. In healthcare, small mistakes scale into big disaster. I propose a phased approach. It includes 3 phases. In first phase, it is 0 to 3 months. Data readiness, governance setup, stakeholder alignment. This is basically getting the house in order before inviting guests. In phase 2, which is 4 to 6 months, pilot testing in selected departments, training clinicians, collect feedback, refine model if necessary. And in the last phase, which is phase 3, spans 7 to 12 months, full deployment with continuous monitoring. Governance checkpoint exists at every phase. To govern, we need a framework. IT governance framework application. In our case, we use NIST AI risk management framework, which includes govern, map, measure, manage. Govern ensures who is responsible, map ensures what risks exist, and measure ensures are we safe and accurate or not. Manage, improve it continuously. Governance is not paperwork. This framework ensures AI is safe, ethical, accountable, and continuously monitored. Without governance, AI becomes a liability. Risk consideration in AI CDSS. AI CDSS introduces multiple risks: clinical risks, bias risks, cybersecurity risks, legal risks. Clinical risks means wrong recommendation can harm patients. Bias risks includes non-representative data leads to unfair outcome. Cybersecurity risks, healthcare data is extremely valuable to the attacker hacker. And legal risks, who is responsible when AI is involved. Here I mention a mini case, where IBM Watson for oncology failed due to not weak AI, but due to poor quality data, limited validation, and inadequate governance, proving that AI without governance is unsafe in healthcare. Ignoring these risks doesn't mean that the risks disappeared. It makes more expensive. Risk mitigation through governance. Governance is how we control this risk. Human oversight prevents blind trust. Clear accountability prevents blame game. Audits detect problem early so that we can take necessary steps. Model update prevents drift and bias. This is AI with brake, mirror, and seat belts, which ensures your safety. So, governance ensures AI CDSS safety. Ethics is not a optional thing in healthcare. Ethics and accountability in AI-enabled healthcare is crucial. Ethical AI requires transparency, explainability, accountability. Patients don't want to hear the algorithm decided. They want to hear doctor use technology responsibly and remains accountable for his action. Trust is the currency in healthcare. Ethical governance is what makes AI socially acceptable. Value creation through governance. Governance is not just about control, it is about value. With proper governance, AI CDSS delivers improved diagnostic accuracy, faster decisions, reduced error. These are tracked through KPIs: error rates, response time, clinician satisfaction, government's review cycle. KPIs shows how fast the car is going. Governance review checks whether the brakes still work or not. If value cannot be measured, governance is failing. Synthesis. Governance as the central enabler of IT transformation. This case shows something very important. Technology enables, but governance sustains the changes. AI CDSS succeeds not because it is intelligent and smart, but because it governed, ethical, and human-centered. Critical reflection. This project taught me something important. Digital transformation is not a technical problem. It is a socio-technical one. AI concept can be generated automatically. But governance, risks, accountability require human judgment and contextual thinking. That understanding cannot be automated. To conclude, AI CDSS improves healthcare decisions when it is well governed. AI governance mitigates risk and ethical concern. Sustainable transformation requires human oversight. Here is the references from where I collected information data and have taken help from these journals and publications to reach in the conclusion and solve the case. Thank you everybody for being with me for a long time, and if you have any query you can drop it in my comment section, or you can mail me, or you can WhatsApp me. Thank you.